pledge for organ donation. So first of all, I'd like to thank each one of you for coming up for that campaign and supporting us wholeheartedly. And it was during that time that a lot of questions and a lot of queries came on how we should do this, what is the right portal to get the registration done, what are the risks associated with it. So a lot of questions. So we decided that let's do a session from an authentic source of information. And so for that, today, to give you more information on that, we have a renowned doctor from Lizzie Hospital. So I welcome Dr. Jayan Thomas Matthew,
Thank you.
a renowned nephrologist from Lizzie Hospital. He's a former professor and head of nephrology at Amla Institute of Medical Science with profound, extensive experience and research in nephrology. So, on behalf of Aries Group of Companies, I wholeheartedly welcome Dr. Jain. Thank you so much, sir, for
Thank you.
taking time out from your really busy schedule and giving us this 1 hour. So, I would request you to kindly take this up from here.
So thank you, Kavita, and a very good evening to all of you. Being a nephrologist, I will talk a little bit about the kidneys because this is the most commonly transplanted organ. Hope I'm audible. My throat has been bad for some time. You can hear me, alle? Okay. So then we will go into the finer details of transplantation, and then we'll have a discussion about what. But being the most commonly organ transplanted, we should know why and what are the functions of the kidney and what you can succeed by doing a transplant. Otherwise, just talking about transplant doesn't make sense. So what are the kidneys? Many people don't know about it, where it is located and what it does. Basically, it's a pair of bean-shaped organs situated on either side of the spinal column. It's on the back, just below the rib cage, about 10 centimeters and about 150 grams weight. And in men and women, the kidneys are in the same location, because many people have misconception about that also. And the kidneys, these are the kidneys. It is continuously filtering blood, producing urine, but we are not passing urine continuously, because the kidneys, as it produces urine, the urine goes through these tubes called ureters and goes into the urinary bladder, where it can stay there for a long time, around 200 to 300 ml. When the bladder is filled, we get a sensation of passing urine, and in appropriate situation we pass urine. So everyone knows the function of the kidney is to pass urine or excretion, but the kidney has so many other functions. It's a very complex organ. It not just does the excretion part, it regulates the electrolytes in the body, the sodium, the potassium, the calcium, the phosphorus. It regulates the blood volume. You drink 2 liters of water or 3 liters of water, you do not put on 3 kg of weight. You drink 1 liter of water, you still do not put on 1 liter. It depends on how much you drink. The kidney will sense it and get it out. And you drink lime juice or you drink coffee or you have whatever, you have a glass of beer, but still the sodium, potassium in your body is normal. It does not change. You have a very high salt diet, still your sodium, potassium is normal, because the kidneys sense it, get rid of what it doesn't want, and keeps what it wants. Blood pressure. The control of blood pressure is again by the kidney. Everyone has a misconception that the blood pressure is controlled by the heart. No, heart is just a pump. The effect of high BP is on the heart, and then it's a vicious cycle. But the blood pressure is controlled by the kidney. Then we have metabolism going on continuously. You are breathing, you had your lunch, so the food that is being is consumed, the carbon dioxide that is coming out of your body, all this is in the blood also, in various chemicals that will change the pH of the body. Now you have to have a very narrow pH, 7.35 to 7.45. Anything outside this is deleterious to the body. So you have a very heavy meal, your pH can change, but it does not change because the kidneys will control it. Then there are various hormones which the kidneys play a role in. The blood that we have, the hemoglobin, all of us knows that it is produced in the bone marrow, but the signal for that is from the kidney. The vitamin D that we have in our food, we get from the sunlight, all those things. If it has to be activated, the kidneys should function. Otherwise, vitamin D will just float around in your blood and be useless. So the kidney has numerous functions. And then a question which everyone asks, how much urine do you produce? It's variable. It depends on the fluid that you take. It's usually about 1 to 1.5 liters. But if you drink more water, in a summer season, you pass less urine. In a colder season, you pass more urine. It's very variable. The most important thing is Why I'm saying this is many people don't know that their kidneys have failed. The most important symptom of kidney disease, do any of you know? ലിവറിൻ്റെ മഞ്ഞപ്പിത്തം ലിവറിൻ്റെ നോ സിംറ്റംസ്, ലക്ഷണങ്ങളില്ല. അറൌണ്ട് 70% ഓഫ് ദ കിഡ്നി ഫെയിൽ ആയാലേ ലക്ഷണങ്ങൾ വരുള്ളൂ. So then it is too late. You cannot cure it. You can only control it. പിന്നെ ഡയാലിസിസ്, പിന്നെ ട്രാൻസ്പ്ലാന്റ് ആയി. So very often patients ഞങ്ങളുടെ അടുത്ത് വരുമ്പം, when we tell them you have kidney failure, they don't believe it. We say that you have to undergo transplant soon, they don't believe it because they don't have any symptoms. Well, if you have heart attack, chest pain varum. If you have pneumonia or any respiratory problem, you'll have fever, cough, breathing difficulty. If you have liver problem, you'll have jaundice. If you have any intestinal problem, you'll have diarrhea, vomiting. But kidney, most often no symptoms. Then the symptoms are very non-specific: tiredness, weakness, fatigue, nausea, vomiting, loss of appetite. Very non-specific symptoms. Breathing difficulty. Nobody will think that the problem is with the kidney. They'll think it is with some other organ. So it is very difficult to tell a person, make them understand that your kidneys have failed and they are not going to work again, and the only option is transplantation. Dialysis can be done, but doing dialysis 3 times a week for rest of your life is, people do it, but it's not very convenient. Well, if you have a successful transplant, you can continue your normal activities by just taking some medicines. Then there are some conditions where you have some pain in the back or in the abdomen. It can be there if there is a stone. Otherwise, normal kidney diseases, kidney failure has no symptoms. There may be little swelling of your face or of your body. Like this child has some swelling around the eyes. He's got kidney failure. Then there are different types of kidney failure. All kidney failure does not need transplantation. Something called acute kidney failure, which happens suddenly over hours to days, like a snake bite occurred, or you have an infection, or you have a severe diarrhea. Many causes can cause the kidney to fail, and in such condition it's called acute kidney failure, which occurs over a few days to weeks. But the most problematic one is chronic kidney disease, and this is the one which has no symptoms, and by the time the patient or his relatives know about it, it's too late. And which are the main causes of kidney failure? Chronic kidney failure is diabetes and hypertension, and India being the diabetic capital of the world, the rate of kidney disease is going to be very high. According to the World Health Organization statistics, 1 in 10 adults have some form of kidney disease. Now, how many of us are there in this room? I'm not saying that you have it. You might have it. You might not have it. As of today, I don't have it because just last week I checked my blood and urine. So I can be sure of the last recent past. But many people don't know about it. And hypertension, nearly 40% of the adults in Kerala have high BP. Many people are not aware of it. Many people don't bother about it. They say, ഞാൻ ഇപ്പോൾ ഓട്ടോറിക്ഷ വഴക്കുണ്ടാക്കിയിട്ട് വന്നുകൊണ്ടാണ്, അല്ലെങ്കിൽ ഒരു ആക്സിഡന്റ് കണ്ടുകൊണ്ടാണ് എൻ്റെ BP കൂടിയത്. എപ്പോഴും അങ്ങനെയല്ല. No, the kidney or the heart or the other organs don't know that you saw an accident or you had a fight with the auto rickshaw driver. It knows that the BP is high and it is getting damaged. So control your BP, control sugar. It's very important. Briefly about diabetes, all of you know about it. I'm not going to details. Basically, sugars are not controlled. It could be because of the absence of insulin, or insulin is there and it is not working. Insulin resistance. These are very broadly. Diabetes per se will take one whole week to explain, but this is just the gist of it. And so what if the sugars are high? Every organ in the body can be affected, from the brain to your big toe. And the most important organs that are affected are the kidney, the heart, the brain. This will kill you. The other things are more of nuisance value. The nerves get damaged, the foot, you can have blood flow which is reduced to the foot. All these things, more of nuisance value. But the thing that kills you are the kidney, the heart, and the brain. And high BP, normal BP is less than 120 by 80. Anything above 140 by 90 is high. And it can be controlled. A simple diet, exercise, and medicines. Now, the problem with medicines is people take it for some time, then they say my BP is controlled, so I stopped it. Diabetic medicines, BP medicines, cardiac medicines, and renal medicine, kidney medicines may have to be taken lifelong. Just like you eat food lifelong. Why are you not eating now? Because you had your lunch and you're not hungry. But after some time, you're going to be hungry. That doesn't mean that say, I had my lunch, I'm not hungry. So you have to eat 3 meals or whatever per day. The same way you'll have to take your medicines to control your BP and your sugar. And then this is what we see in the market. Buy one, get one free. Buy diabetes, buy high BP, you get kidney failure, heart failure, stroke, everything free. Buy 2, get 5 free. That is what will happen. And then what causes all this? Malayali's favorite food. Bhaji, vada, bonda, samosa, padampuri, all of us have it every other day. I'm not saying don't have it, but be careful, because these are the things, as long as your kidneys are functioning, they will do well. Just think of it. You are 10 of you working in the office. 2 people take leave, the 8 of you have still to do the same amount of work. Or your boss gives you extra work for the same 10 of you. Here, you are giving extra work to your kidney. Few days you will accept. After some time, you say, I can't do it. This is exactly what happens to the kidney. So, what can you do to treat it? We should not reach a stage of transplantation. We should pick it up early and prevent the or delay the progression of kidney failure. Now, how do you know that you have kidney damage? As I said, there are no symptoms. So, you have to test your blood and urine. Now, all of you, I'm sure, will have some vehicle, car, bike, or something. Even if there is no problem, once in 6 months or once in a year, you do a preventive maintenance, you do a checkup for your vehicle, you do it. But what about your body? We never do it. After the age of 18, get your BP checked, get your sugar checked, get your urine checked, do a liver function and a kidney function test. If it is normal, forget about it. Next year, you do the same. If it is abnormal, catch it early and you can delay the progression of kidney disease. Because time is ticking away, you have to follow the instructions. Very often, because it's a long term thing, patients will take it for some time and they stop it, and then they progress and they reach end stage, and then they'll have to undergo dialysis or transplantation. Blood pressure should be controlled. It should be controlled. Don't say that the excuses which the patient usually says, I had a fight, the lift did not work, or all those things. BP should be controlled as low as possible. Reduce the salt in your diet. We need only around 4 to 5 grams of salt in a day. We Malayalis eat around 30 to 35 grams of salt every day. 1 spoon of pickle, 1 papadam is enough for your whole day. But how many do we take? We take pickle just like we have curry. So that is a problem. Medicines should be regular. Alcohol should be avoided as much as possible. Same thing with sugar. Control. The diet is important. The medicines are there. Insulin is there. Whatever is required may be taken. But you have to be careful, because in a diabetic, if the kidney starts getting damaged, you have 18 months before you reach a stage of transplantation. So very important to control it. We can control it. We can control for years together, but it is important to recognize it and control it. And a little bit about the diet. Basically, you have to prevent the kidney from getting damaged. So you have to avoid stress to the kidney. So avoid oily food, less non-vegetarian food. Again, regarding fluid, nobody knows how much fluid to drink. It's a question which everyone asks. How much water should I drink? A healthy person can drink 2.5 to 3 liters of fluid, no problem. But if a person has kidney damage, kidney failure, you have to cut down, because you have to give rest to the kidney. Don't give the kidney extra work. So if there is kidney failure, restrict the fluid. Now, if there is urinary infection or stone or something, you might have to drink more water. So you cannot give a blanket statement. You have to play it by the ear, play it by the symptoms of the person. But if the kidney is damaged, don't give it extra work. Give it rest by reducing the salt intake, by reducing the fluid intake. Definitely no smoking. And in spite of all this, the kidneys are going to progress. Kidney damage is going to progress. Unfortunately, we don't have anything to reverse it completely. Now, a lot of research is going on, but as of now, if the kidney gets damaged, it's going to progress. And then we have only few options. One is dialysis. There are 2 types of dialysis, which is done in the hospital or at home. The peritoneal dialysis can be done at home, or we have the transplantation. The most important and the cheapest and the best form of treatment for the person is kidney transplantation. The donor can be a living person. Now, there are rules and regulations for it. According to the Organ Transplant Act in India, only the first degree relatives can donate. Father, mother, siblings, children. Recently, amendment is there, grandparents or grandchildren. But I don't think a 70-year-old kidney is going to work in a 10-year-old, 12-year-old child. Or a 60 or 75-year-old person is not going to accept their grandchildren's kidney. It's, on paper, it is there, but it's not going to happen. If none of this is available, you can spouse can donate. And if spouse is also not there, then a person can donate. A friend or altruistic person can donate. You cannot sell your organs because it is illegal. So that is one type of donor. The other type of donor is a deceased donor, means a person who suffered brain death. Now, death can be of two types. Previously, death was defined when the heart stops beating. But now the definition is changed. Cardiac death is there, but brain death is also there. That means the brain, which controls all the other organs, the brainstem is damaged, so their patient is a vegetable, but the other organs are functioning because of its autonomous function. Like the heart can go on beating for some time. Lungs will not work, so you have to put the patient on the ventilator. But the heart can keep on beating for a definite, significant amount of period of time, but he is not going to recover. His brain functions are going to is permanently gone. So that is called a deceased donor. We'll look into it a bit more in detail. Dialysis is the most common form of treatment. Even our friend Oduvil Unnikrishnan was on dialysis for the last few years of his life. It's a very comfortable procedure, no pain or anything. Patients come, get dialyzed, and go 2 or 3 times a week. No pain, but 3 times a week or 2 times a week, lifelong is not very easy. That means 50% of your life you're going in and out of the hospital. So, if you can avoid it, best thing. Then there is something called peritoneal dialysis, which can be done at home. I'm not going to the details because that person will take a lot of time. Let's come to our topic, transplantation. Transplantation is the process where the person's, I'm talking about kidney transplantation now. Both the kidneys have failed irreversibly. He can live only by dialysis or by an artificial kidney. So what we do is a healthy person will donate the kidney, and that is taken out surgically and implanted in the person who has kidney failure. Now, we do not remove the native kidneys. It is still there because that itself is a major surgery. So let it be there. Even if it gives 5 ml of urine, it is good. While the other kidney can be taken and planted, it's not put in the back where the original kidneys are. It is put in the lower part of the abdomen. It's called the iliac fossa. It is in the lower part of the abdomen, and it is attached to the artery, vein, and the urinary bladder. So this is just the same thing. The kidney is taken out and placed in the lower abdomen. The advantages are, once it is very superficial. So if there is any problem, you can immediately go. The native kidneys are very deep. So getting there is a major surgical procedure. While here it is just below the skin. Any problem, you can see it. As I said, surgical problem, you can correct it also. And if you want to do any test, taking a piece of the kidney by putting a needle, it's right under your skin. So it can be done. So basically, what is organ transplantation? When the damaged organ, it can be the liver, it can be the kidney, it can be the heart, or any other major organ, lungs, intestine, pancreas, when it is replaced by a functioning one. The donor can be a living person, as I mentioned, or it can be from a deceased, a dead person. Previously, the term cadaver transplant was used. Now it's no longer used. It's very gory. So we say deceased donor or brain death donor. And in some cases, animal organs also can be used. You might have read recently about the pig kidney being transplanted and person surviving and all. So there are some conditions where you can take it from a living person, some conditions where you cannot take it from a living person. Kidney can be donated by a living person. You have 2 kidneys, you can donate 1. Heart cannot be donated by a living person because the moment you take the heart out, that person is dead. This thing, liver can be given by a living person. You don't take the whole liver, you take part of the liver and give it, because the liver grows rapidly, and you take 90% of the liver and put it in the other person. The person who donates the kidney who donates the liver, his liver will regenerate fast and it will do a good function. So a living donation is possible for a kidney, for a liver, but not possible for a heart. So those are the things. And kidney is the most commonly transplanted organ, followed by the liver. Why is it important? We don't have much statistics in India, so I've just got some statistics from US. More than 1 lakh people are in need of organ transplant. This is about 2 years ago statistics, and 41,000 transplants were done in 2021. Every day, around 17 people die because of lack of organs, and this is in US. In our India, the numbers are much higher. We know our population, we know our not so good control of diabetes and hypertension. So the number of people reaching end stage, either kidney failure or liver failure or cardiac failure, is much higher. And in a well-educated, I'm putting educated in inverted comma, country like US, where they all say we'll support organ transplant, how many of them are willing to give? Very few. Because I'm willing to say that I will do it, but when the actual time comes, people are scared. Because I'm going to talk about only deceased donor, brain death. Now suppose a person has an accident. Suppose I have an accident, I have a brain death which I'm not going to recover. I cannot give consent because I'm gone. So my next in kin has to give consent. So not just the person who's willing to donate, but their immediate family also should be aware of it, and they should also be willing to donate. All the donor cards, everything is there. But ultimately, when it comes to a court of law, the the moment you are dead, the body does not belong to you. It belongs to the next of kin. Maybe your spouse, maybe your parents, maybe your children. They should be the one to give authority. Because at that point, they are the ones who are giving. Now, if just before I die, I say I give it, it's okay. But all these things happen suddenly. A road traffic accident, I'm not going to, just before the accident, I'm not going to pledge my kidneys. I can put it in a donor note now, but still in a court of law, if somebody contests it, it can be a problem. So it's important, not just the person, but your immediate family members, whoever is responsible, should also be aware of the willingness. And again, no one is too young or too old to donate a organ. I'm talking about deceased donor, brain death donor. Living donor, I'm not talking about it because it's only the kidney and the liver, and then there are a lot of restrictions for it. But in a brain death donor, even a 2-year-old child can donate. If the child is brain dead, they can take 2 of kidneys, and it has to be to another child. It cannot be to an adult. So a lot of children with kidney failure are there, a lot of children with cardiac failure are there, liver failure are there. They can also benefit. A 70-year-old person, if he is otherwise okay, brain dead, if his heart is okay, kidney is okay, it can be used, because the number of people waiting to get a kidney or a heart is enormous. And then many people have a misconception that if I am an organ donor, registered donor, if I have an accident, they will not save me because they want my organs. No. 99.9999% nobody will do it. 1 in a million, there may be unethical people, just like every other profession. But a person, however bad the person is, however, even if it's your worst enemy, if he comes to a doctor, your thing is to save his life. The rest of it can be your war, everything with them can be later. So nobody will not resuscitate you, will try the best to get you back to life. If everything fails, then only they go for organ donation and those things. Then many people are again worried about the funeral things. What will happen to the body after that? Will the whole thing be cut open? No. It will be cut at those places, it will be taken, but it will be sutured back properly, because any road traffic accident needs a autopsy, needs a postmortem. So anyway, the body is going to be cut, but it will be sutured back properly, decently, so that a proper funeral can be given. What about the cost? People are worried about the cost. Now, if I am brain dead, I'm going to be maintained on the ventilator with all those supports for a longer time, so that X, Y, or Z can get my organs. No, the moment I am declared brain dead, I don't have to pay anymore, or my family will not have to pay anymore. The bill will be immediately transferred to the potential recipients. So till the point I am declared dead, the bill will be on me or my family or my insurance company or whatever. The moment death is declared and organ donation is being planned, the potential recipients will have to pay for from that point of time onwards, for the maintenance of the body, the maintenance of the organ, all those things. The other thing is, one person donating, one brain dead person donating can save 7 to 8 lives. 1 heart, 2 kidneys, liver, pancreas, lungs, eye. So many people will benefit from one person donating their organs. It may not be possible for one person to donate all the organs, because of a road traffic accident, if you have a vehicle running over you, it's all crushed and gone. That may not be possible. But the organs which are intact can be utilized, and it's not just saves those individuals, the family. If a person who is going to receive this kidney has been on dialysis for so many years, that person's one bystander has to come to the hospital along with the patient each time. See, if a person is on dialysis 3 times a week, it's not just his 50% of the life in the hospital. His bystander also has to come. If the breadwinner is going to the hospital, the spouse has to come. So the cooking is gone. The household activities are completely disarrayed. While if you have a transplant, all those things come back to normal. They can stay in the house, just get their medicines done and have their checkup. They don't have to come to the hospital 3 times a week for rest of their life. So that is also important. And as I mentioned, the organs which can be transplanted, predominantly the heart, the lungs, liver, kidney, pancreas, intestines, and the other structures also can be the eye, the skin, the bone. Skin can be used. A lot of people suffer burns. Heart valves, the veins can be utilized. Now, recently we've had face transplantation, hand transplantation. So just the picture of this. The most common, number one is kidney, number two is liver, and number three is heart. The most commonly transplanted organs in India. Now, how long can you keep the organs out of the body? Because if the brain dead person is in Cochin, the recipient might be in Trivandrum. Recently, you've seen in the newspaper or on the TV about the organ being shifted, rushed from point A from Palakkad to Trivandrum and all those things. See, for a lung and a heart, you have to do it immediately. You have a very short period, it will survive outside the body. But the kidney can be kept up to 72 hours. Nothing will happen. You don't have to open a green channel and rush from Palakkad to Trivandrum. You can go ordinary vehicle, reach there. You don't have to rush for a kidney. Heart and lungs, no two ways about it. It has to be done immediately. So depending on the organs, we should think. So you should not disturb the public because of this. You've seen recently how the road was blocked and all for things to transport a kidney from Palghat to Trivandrum. That was not required. This is happening. Why? Because the number of deceased donor transplants have come down, and each transplantation has become a news item. In the Western countries, this is a routine thing. Nobody talks about routine things in the newspaper or on the TV. It's only when an unusual thing happens that media gives the publicity. This should become a usual thing, so that it is done. There's a protocol. Things are automatically done. You don't have to open a green channel or do all those things. Now, there are many misconceptions and fears. Fear of death, because the person is having a head injury, or it's not just a road traffic accident, might have a tumor, might have a bleed into the brain because of high BP. So fear of death is there, but then no doctor will not try to save you. Then there is a fear that the removing the organs, your sanctity of your body is lost. Once when I was doing my training in Vellore, when we asked for the organ, when the brain death occurs, they said you can take the kidney, but don't take the eye. And why not eye? Shivane കാണാൻ പോകുമ്പോൾ കണ്ണില്ലാതെ എങ്ങനെ കാണും? These are all misconceptions. Then we had to get the priest from their village to come and explain to them that ശിവനെ കാണാൻ പോകുമ്പോൾ കണ്ണില്ല, ശിവനല്ലാതെ നമ്മളെ കണ്ടോളാം എന്നൊക്കെ പറഞ്ഞ് മനസ്സിലാക്കിയിട്ട് the organ they gave, but we have to make them understand. These are all small misconceptions about being cut. Yes, any surgery you need to cut, but you don't mutilate. You do a proper surgery. Even if the person is dead, you do a proper surgery. You don't just randomly cut here and there. Then many people are worried, what will my kidney do inside somebody else's kidney, in somebody else's body? It is an issue. There are some movies also about it. I think there's one movie in Jairam movie, somebody, his heart was transplanted and then that person was going after him or something. I forgot the old movie. So these things are misconceptions. Such things don't happen. Then again, religious conviction. There are no religions that prevents organ donation. Every religion except Jehovah Witness, they don't accept blood transfusion also. That is one group which does not accept donation. Almost all other groups, all other religions, all other communities accept this. Then there are a lot of social issues. Those who have seen the X-Files or seen the movie Coma, the movie, that's one of the first novels written by Robin Cook. He's a doctor. It's a science fiction about how the people are killed to harvest organs. This is in the 1980s. It does not happen. It will not happen. Because if I want to steal an organ from the person's body, I cannot do it alone. I need the whole team there, because in theater there are nurses, there are technicians, there are anesthetists, there are other surgeons, then there's a supervisor. The whole, however bad that group is, there'll be one person who's will not join that group. So it is not possible to steal. People think that by going for a surgery, kidney അടിച്ചോണ്ട് പോയി. It cannot happen. There's a very interesting incident when the patient was being anesthetized. They are not fully awake, not fully knocked off also. They are in the transient area when they are just going, the senses are going off. The doctor asked to bring the kidney tray. Kidney tray is a tray in the shape of a kidney. That's where we put the waste. After draping the person, after cleaning the person, all the waste is put in that. It is called kidney tray because of that shape. And then the patient, in the vague memory, that kidney in the name was there. Surgery was done. Then they said, "Ende kidney adichondu poi." Fortunately, they did an ultrasound, proved that both the kidneys are there. But these things happen. So nobody will. And the recent movie Joseph, all of you would have seen. That was the last nail on the coffin of cadaveric transplantation in Kerala. After that, I think very few have been done. That will not happen. That's a fiction. It's a very good movie. Very good movie. If you look at it as a point of view of a movie, it is excellent. But it is not reality. It's a fiction. So, but unfortunately, people think like that and believe that that is the truth. That is one side of it. Then in Thailand, this issue occurred. They said that the doctor took the kidney, harvested the kidney, sold it and all. And they killed the patient. Actually, they said they killed the patient. But when they actually found out, brain death had occurred. But that communication was not clear. So the important thing is to communicate to the people, tell them that this is what is happening. That is why we need awareness. That once you're brain dead, you do not need your kidney or your heart or your lungs or anything. Let it go to somebody else. And after the inquiry, the whole thing was cleared. But then I don't think those doctors will ever operate again, because they've gone through that much of mental trauma. The other side of it is the positive side. There was this boy called Nicholas who was shot. He was an American who was shot accidentally by bandits in Italy in 1990s. His parents decided to donate his organ. And that revolutionized the organ transplantation in Italy. So media can kill it, or media can really build it up. And it's our the responsibility to give the positive sides of it. Now there are myths. The same thing what I said. If I am in an accident and the hospital knows that I am designated as a donor, they will not try to save me. No, it will never happen. Whatever happens, the first of all, we won't know who's a donor or not, because at that time we don't look at the driving license or to see if you're a donor, have a donor card or anything. The moment a person is brought into trauma, the first thing is to save the patient, irrespective of what it is. Then only all these things are looked into. Again, I mentioned about the charges. Till the person is alive, the person or his family or his insurance will have to pay for it. Once brain death has been declared, the bill is immediately closed there. A new bill is there. It is transferred to the potential donors, potential recipients. Then some people say, if I have some other illness, can I donate? Now, if I have a tumor, some people have brain tumor, they die because of brain tumor, they can donate. A young person with a brain tumor can donate because other organs are normal. So it can be done. And every organ may not be able to be harvested. Now, if a person has very high BP and he developed a bleed into the brain because of the high BP, maybe his heart or kidneys would have been partially damaged. They may not be able to take it, but they can definitely take the cornea, they can take the lungs, they can take the intestines, all those things. They can take the hands. Then some people think that brain death is the same as coma. No. Coma is a state where the person is unconscious for a long time but can be reverted back to normalcy. Brain death is irreversible. Coma is reversible. Brain death is irreversible. And one person cannot certify brain death. You need a panel of doctors. There are guidelines. Neurologist or neurosurgeon, the medical superintendent, and the treating physician, all of them. It's not just one person. And never is the transplant team involved in declaring brain death. Because as a nephrologist, or as a liver transplant surgeon or as a cardiac transplant surgeon. They will not come. The patient is not theirs. The patient is admitted under trauma ward, under neurosurgery, or under orthopedics. So it is never our patient. It is somebody else's patient who develops brain death, and then after declaring brain death, then they, or when they are about to declare brain death, they'll call the concerned specialties like nephrology or cardiology or whatever, saying that potential organs are available. Do you have any potential donors? Then we can call them and then plan for all this. The concept of death, which I mentioned earlier. Initially, cardiac death. The heart has to stop beating for a death to be declared. But now the concept is changed. Brain death will occur. The patient's brain is damaged. Heart can continue beating because heart per se has autonomous power to continue beating. It's not indefinite for a short period of time, maybe for a couple of days or so. You take the heart and put it outside, it will still continue to beat for some time, and then it will go off. Inside the body, as long as the blood pressures are maintained and the heart given oxygen through the ventilator, the heart can be kept on going for some more time. You have medicines to keep it going. It's not indefinite. There is a limited. So we have to harvest the organs within this period of time. So people should not think my relative's heart is beating and still they took the heart out. Yes, you need a beating heart to give it to the other person. A heart which is stopped completely, there's no point in transplanting. Only after irreversible brain death can all this be done. So as I mentioned earlier, different organs, different people can benefit. One brain death person can give a heart, 2 kidneys, a liver, pancreas, lungs, intestine, and other organs can be done. So why should I become a donor? Because there are thousands and thousands of patients waiting for kidney transplant. In Kerala, as of today, the registered numbers are more than 2,500. Registered waiting for a transplant. There are so many others who are unregistered. This is for the brain death, for the deceased donor transplant in the Kerala government sector. Private sector, the numbers are much higher. Every day the numbers are going to increase because just now we had the new year. The amount of alcohol consumption every day പത്രത്തിൽ കഴിഞ്ഞ വർഷം ചാലക്കുടിയാണെങ്കിൽ ഈ വർഷം മറ്റേ സ്ഥലം ഇരിഞ്ഞാലക്കുട number 1 ഇത്ര കോടിക്ക് alcohol വിറ്റു. All this is going to damage the liver. Having a drink once in a way is okay, but unfortunately our people have it every other day or have it every day. Liver is getting damaged, heart is getting damaged, our lifestyle is damaging our kidneys, our heart. So the number of people who require an organ is going to keep on increasing, and many of them die without getting an organ. Unfortunately, they die because lack of organs. They don't have a person in the family to donate. There's some diseases like diabetes, it's there in the family. So if I am a diabetic, I'm not. If I am a diabetic, my sibling is also likely to be a diabetic. So then we cannot take the organ from that sibling. Similarly, many hereditary conditions like polycystic kidney, you cannot harvest because it's all in the family. The other person also will have kidney damage later. So that is why healthy people like us should be willing to donate after a death, after brain death. You don't have to donate today. If by the unfortunate event you develop a brain death, then you donate. You're going to die of old age or of something in your home, that's different. You can't donate. This is for people who develop. And the number of road traffic accidents that occur every day, you see the Charama column now. Previously it was one page, now it is spilled over to the other page also, and the other page has more of all these deaths due to accident. Everyone is a potential organ donor unless you have severe infection, you have HIV, you are a IV drug abuser. Those patients, those people, we do not take the organs from. Even if you have hepatitis C, you have treatment for it, you can use the organs. Previously there was a scare that if you take hepatitis C infected organs from a person and put it into somebody else, the recipient might develop the infection. No, we have good medicines to cure that also. Cancer patients, they can donate. You can't donate the organ which had cancer, but you can donate the other organs if they are healthy. Can I sell my organs? No. There's a law against it. It is illegal to sell. You can be in jail. And there are instances when the donor, the recipient, poor fellow, is in the hospital, that doctor. This happened in Punjab. They were in prison. Now, for more details, we have something called Mrida Sanjeevani or Kerala Network of Organ Sharing. website is there. Just put Kerala and organ, and you can get it. Google it and you'll get it, and that will tell you the current status, how many organs have been transplanted. I did not put up the other pages of this because it's a very sad thing. Till 2016, 17, 18, the number of transplants was very high. Suddenly, after COVID, and after that, it's come down to newspaper reporting number of cases, single digits. Previously, it was more than 200, 250, and all transplants were being done. That is a very small number, but from that, it's come down to single digits due to misconception by many people. And at a national level, we have National Organ and Tissue Transplant Organization also. So we have one for our state, and at a national level, you can just Google it, you will get all the details. And this will tell you how you can be a potential donor or anything. Have you seen this picture? You might have seen it. It was there in the newspaper. This is Dr. Subramania Iyer. He stays in the same flat where we stay. We worked together in Amala many years ago. He did the first double hand transplant in the world in Amrita. And this is a Afghan person who lost his hands in the mine blast. And for many years, he did not have a hand. And Dr. Subramania Iyer got it from a deceased donor who had brain death. And just look at his wife and daughter. They are not looking at Dr. Subramania Iyer or him. They are looking at his hand. The same thing. It may not be a pure, beautiful anatomical hand. You cannot go for Miss World or Mr. whatever universe with that. But you can survive. You can live. Imagine somebody else feeding you for the rest of your life, or with difficulty, you can still eat by yourself. It makes a big difference. Then we have animals, organs from animals that can be used. Still in the research phase, some have been used, and the most similar to the human being are the pigs. In all ways, behavior wise also we are like them. Monkeys anatomically is similar, but they are much smaller. So the size of the organ of the kidney of the monkey is so small, but pigs' kidneys are almost the same size as human kidneys. And the advantage is you have unlimited access to organs. The number of pigs that are being killed for meat, why can't we just take off the organs and then kill it? So you have much thing. This deceased donor transplantation is an emergency. A regular transplantation is planned. Now we have the next transplant coming up on Monday. The person is admitted yesterday. Medicines have been started and all those things. We are under control for a regular related donor transplant. But deceased donor transplant, I don't know when I'll get the next call from the coordinator saying that we have a brain death person in such and such a place. We don't know. And then we have to, within hours, we have to work. Kidney, we have some time. As I said, we have up to 72 hours, but still the earlier the better. Heart and lungs, you have to do it immediately. So it's an emergency, you don't have time to prepare. But here you can prepare the organ. You don't like that organ, you throw it off and take the next pig's organ. So once this comes up, you'll have unlimited organs. But till then, still in the research stage, we have to. So tomorrow you might have a condition like this, when you have a potential donor coming from the pigsty. And this might be a fiction today, but tomorrow it might be the science. The organ coming from the pig farm, the patient going from the dialysis room into the theater. But coming to all that, how can we prevent it? Proper diet, good exercise, healthy lifestyle, check your bodies. This is the only way to prevent. We are all living in a very fast-paced life. Traveling from Kakinad to wherever your house is, your BP is definitely going to shoot up. And I've seen how the people, especially on the bikes, how they just weave the way through the traffic. It's dangerous for them as well as for the people in the four-wheelers also. But there is a stress which everyone is going through, the pollution. No time for exercise, because tomorrow morning again you have to be here on time. And your colleague takes leave, you have to do their work also, because you have to impress your boss, you have to earn your salary. We have no time for exercise. You must take time for exercise, or at least do this in your office. Take time. After 1 hour, take a 5-minute break, or after 2 hours, take a 5 to 7-minute break. Do some stretching exercise because your body needs it. We are sitting. Sitting is more dangerous than smoking. Sitting continuously is more dangerous than smoking, because your blood flow is very sluggish. The risk of all these complications are much higher so if you have to sit for 1 hour, get up and walk for 2 minutes and then go. Just out of the way, when the IT things came up in California, they suddenly found out that the smokers had a lesser incident of heart attack. Why? Because they had to go 3 blocks away to smoke. They were not allowed to smoke in that area. So they got good exercise, and because of this, they did not go frequently to smoke. If they were allowed to smoke in the room, they would have been chain smokers. So they cut down on the number of cigarettes as well as got a good exercise compared to the non-smokers. So I'm not saying smoke and then walk for 2 blocks. What I'm saying is you need exercise. Don't go by numbers. Don't go by BMI and all those things. It's good to have numbers, but as long as you're cardiorespiratory fit, that is more important. Having 1 or 2 kilos extra or something does not really matter. All of us cannot be Aishwarya Rai or Sushmita Sen or Akshay Kumar, whatever. All of us are individual people. All of us have our own beauty in our own ways. So there's just a book I had written about how to detect kidney disease, Rukkale Samrakshikika. And this website, we have a website in English and in Malayalam, and this website has more than 1 million hits now already in the last 1 year. And the problem of transplantation is this: if a living transplantation is there, tomorrow if your divorce is going to happen and the spouse asks for the kidney back, you are in trouble. So thank you. Hope I did not overshoot the time. No. So if,
the 2 websites that you showed, that is the registered site.
yes,
for,
yes.
donation.
The KNOS and the Sinoto.
That is where we have
Yes. That gives you all the details also, and all the doubts can be there. We have a nodal officer for Kerala. He's in Trivandrum, Dr. Noble Gracious. He's in Trivandrum. And so, do you have any doubts?
ഈ മെഡിക്കൽ ഫീൽഡിൽ നിന്ന് എത്ര പെർസെന്റേജ് ഡോണേഴ്സ്?
ബ്രെയിൻ ഡെത്ത് കുറേ ഉണ്ട്. ലിവിങ് ഡോണേഴ്സ് വരെ ഉണ്ട്. ഫോർ പേഷ്യന്റ് കൊടുത്ത കണ്ടീഷൻ വരെ ഉണ്ട്.
As you guys are educated with the medical field,
Yeah.
So you are fully motivated
Yes.
from the beginning.
Yes.
So can you say how many medical students or whatever they became donors?
No, see, we don't ask any of you to be donors now.
Just
It's after brain death. So we don't know when you are going to die. See, take your case, for example. You, as a person, you are going to be, suppose you give yourself as a donor, pledge yourself a donor. Nobody is going to take your kidney till any time now. Only if you develop a brain death, which the chance is very little. But with the population of our country, the number of accidents that occur every day, the number of people who die, if those organs can be utilized, അതാ പറഞ്ഞു വരുന്നത്. So everyone should be willing to be a donor. I'm not just saying medical, non-medical, everyone should be willing to be a donor. We are trying to motivate everyone, not just me or you. Everyone should be, and 99.999% organs will not be taken because we'll die of a normal death, old age, or whatever. It's only the brain death accidents occur. Now in Kochi today, how many vehicles are there on the road? How many accidents occur? Maybe 1 or 2. But in a country like India, those numbers are big. And those organs can be harvested. അതാ പറഞ്ഞു വരുന്നത്. I'm not telling you that you should go and give your kidney to anybody today. No, I'll never say that. അതെ. അതെ.
ചോദ്യം മെഡിക്കൽ ഫീൽഡിൽ നിന്ന് കേരളത്തിൽ തന്നെ എത്ര മെഡിക്കൽ സ്റ്റുഡൻസ് അല്ലെങ്കിൽ മെഡിക്കൽ ഫീൽഡിൽ
I don't know, because if I pledge, you won't know. എൻ്റെ കൊളീഗ് പ്ലഡ്ജ് ചെയ്തിട്ടുണ്ടെന്ന് I won't know. They're pledging it to this website. His family might know. Adina, we cannot take statistics. We do, definitely. I didn't come to motivate you. I was called to come and give a talk to clarify your doubts. I used to take regular classes regularly, but ingante rendu moonu chodyam vannappo I stopped. Because don't think that, no, one person, എൻ്റെ കൂടെ നിന്ന person who is not a doctor, he said, നിങ്ങൾ എല്ലാവരും നഴ്സിംഗ് സ്റ്റുഡൻസിനോട് നിങ്ങൾ എല്ലാവരും നിങ്ങളുടെ കിഡ്നി ജീവനോടൊപ്പം കൊടുക്കണം. No, I objected then. That was the last thing I gave. It was about 6-7 years ago. Two of us were on the stage. He was called as a chief guest, and he told the people, നിങ്ങൾ എല്ലാവരും നിങ്ങളുടെ കിഡ്നി കൊടുക്കണം എന്ന്, which I will never say. After brain death, yes, your family can give it, but he wanted them to give it as living people. Never. I will never say that, because tomorrow your family, your spouse, your sibling, your parents, children, they might need it, and you might be the only potential person. So I will never say give it for. Today I have around more than 150 patients on dialysis just today. All of them need kidneys. I will not tell 150 of you come and give your kidneys. No, I will never say that. If by any chance that you develop a head injury and you cannot be saved, then please give, not just to you, to everyone in this thing. Actually, some countries, if you need a driving license, you have to be an organ donor. It's a must, because our state decides. In India, anything will happen.
നമ്മൾ ചെയ്തില്ലെങ്കിൽ ആഫ്റ്റർ പെയിൻഡേഴ്സ് നമ്മുടെ പാരന്റ്സിനൊക്കെ ഡിസൈഡ് ചെയ്യാൻ പറ്റുമോ?
പറ്റും നമ്മൾ പ്ലഡ് ചെയ്തില്ലെങ്കിൽ പറ്റും.
Pledge ചെയ്താലും we need their,
Yes, pledge ചെയ്താൽ, but only thing it makes things easier.
even if we pledge, we need their consent.
Yes, because see, ഇല്ലെങ്കിലും വലിയ കുഴപ്പമില്ല. But if the case of, I'll give you one case which has happened. Bangalore നടന്ന, husband and wife had accident, wife brain dead, husband in coma. So the daughter, adult daughter, 24 or 25-year-old, she was in the software industry. She gave consent കാരണം അപ്പന് unconscious, and then done happily. The other 3 or 4 people are surviving happily. After many weeks, the husband came up. He survived, and he said, without my consent you didn't do. Case പോയി. But these are all issues, and within the family appanum molum തമ്മിൽ പ്രശ്നമായി. He said, I am the person to decide. She is unconscious, lying for how long can you wait? ഇതൊരു വേറെ മോഷ്ടിക്കൊന്നല്ല ചെയ്തത്, നല്ല കാര്യമാണ് ചെയ്തത്. And the case came, and said at that particular point, next in kin is this person, and she gave consent. It's okay. But if the wife had the donor card, your issue prashna variyallarnu, because the wife has already pledged.
It is always safe to have that.
Safe to have it, because you don't know tomorrow what happens. We don't know. See, you, God forbid, your first and next in kin may not be the one who is there at that time. You don't know if that person is there at that time. So if you have it, it makes easier for the people. It is not a binding law. It makes easier for the people to take the decision.
നമ്മുടെ റെക്കോർഡ്സ് എല്ലാം ചോരണം എന്നുള്ള ഒരു പേടിയുണ്ടായിരിക്കും കുറെ പേര്.
And that is one
നമ്മുടെ
concern.
ഏതാ?
നമ്മുടെ data is all getting,
So, ഇത്
shared out.
ഏത് ഡേറ്റയിലേക്കാണ് നമ്മൾ
When we register, our data is getting shared.
നിങ്ങൾ ആധാർ എല്ലായിടത്തും ഇല്ല, അതിനകത്ത് ബാങ്ക് അക്കൗണ്ട് വരെ പോയി പാൻ കാർഡായിട്ട് ലിങ്ക് ചെയ്തിരിക്കുക. ഇനി എന്ത് ഡേറ്റ പോകാനുള്ളത്? വാട്ട് മോർ? ഇല്ല, ഇല്ല. അങ്ങനെയാണെങ്കിലും ബ്രെയിൻ ഡെത്ത് ആണെങ്കിൽ, ബ്രെയിൻ ഡെത്ത് ഇസ് നോട്ട് ആക്സിഡന്റ് അലോൺ. ഇങ്ങനെ പല അസുഖങ്ങൾ, ഇപ്പം ഹൈ BP വന്നിട്ട് സ്ട്രോക്ക് വന്നിട്ടൊക്കെ മരിക്കുന്നതാകാം, ട്യൂമർ കാരണത്ത് മരിക്കുന്ന, ദാറ്റ് ക്യാൻ ബി ഡൺ. അല്ലെങ്കിൽ if the death occurs in the hospital and immediately the organs can be harvested, it can be done. പക്ഷെ നമ്മൾ അവിടെ വരെ എത്തിയിട്ടില്ല. We have not reached that stage. US അത് ചെയ്യുന്നുണ്ട്. അതിന് ബ്രെയിൻ ഡെത്തിന് തന്നെ ഹാർട്ട് ബീറ്റിങ്ങും നോൺ ഹാർട്ട് ബീറ്റിംഗ് എന്നും പറഞ്ഞുണ്ട്. ആക്സിഡന്റ് സംഭവിക്കുമ്പം the trauma team goes to the accident site and harvest the organs there. സോ ആ ഹോസ്പിറ്റലിലോട്ട് എത്തിക്കുന്ന ആ ടൈമും കൂടെ ലാഭിക്കാൻ പറ്റും. ചിലപ്പോൾ ഹോസ്പിറ്റലിലോട്ട് എത്തിക്കുമ്പോൾ ഹാർട്ട് മൈറ്റ് സ്റ്റോപ്പ്, അതും ലാഭിക്കാനായിട്ട് പറ്റും. സോ അങ്ങനത്തെ ഒരു സിറ്റുവേഷൻ നമ്മൾ അവിടെ വരെ എത്തിയിട്ടില്ല. ഇന്ത്യ വി നോട്ട് റീച്ച് ദാറ്റ് ഫാർ. പിന്നെ ഡേറ്റയുടെ കാര്യം, ഈ സൈഡിലോട്ട് ഐ ഡോണ്ട് തിങ്ക് നമ്മുടെ ആധാറിൻ്റെ ഒക്കെ കൊടുക്കണം എന്നൊന്നുമില്ല. അതിനകത്ത് നമ്മുടെ പേരും അതും മാത്രമേ ഉള്ളൂ. ഐ ഡോണ്ട് നോ എക്സാക്ട്ലി വാട്ട് ആർ ഓൾ ദ ഫൈനൽ ഡീറ്റെയിൽസ് ദറ്റ് യു ഹാവ് ടു ഗിവ്. നമ്മൾ വേറെ ഒന്നും വേണ്ട, ഞാൻ ചെയ്യുവാന്നൊരു ബോണ്ട് പേപ്പറിലോ ഒന്ന് സ്റ്റാമ്പ് പേപ്പറിൽ എഴുതി വെച്ചാൽ അത് മതി. And you should, your next of kin should know that you're willing to donate.
And so if a lot of us are having lifestyle diseases like cholesterol and diabetes, it's still okay that if we can.
Yes, you can, because see, just because you have diabetes or just because you have hypertension does not mean your organs are damaged. We do not take it from a living person, because that person can develop complications in the future. Now, if I am a diabetic, 10 years, and today I'm okay, but 10 years down the line, I might develop kidney failure. So if I give off one kidney, I'm stuck with only one kidney. But if I'm a diabetic today, my kidneys are okay today, and I have a brain death, take both my kidneys, no problem. Because it does not affect my life in the future. But ഞാൻ living ആയിട്ട് ഇരിക്കുമ്പോൾ ഒരു കിഡ്നി കൊടുത്തു കഴിഞ്ഞാൽ, and 10 years down the line, if I develop kidney problem in the other kidney, then I'm in trouble. So other issue.
കിഡ്നിയുടെ ഈ ടെസ്റ്റ് ഏത് ടെസ്റ്റ് ആണ് ചെയ്യേണ്ടത്?
കിഡ്നി അസുഖം ഉണ്ടോന്ന് അറിയാനായിട്ടോ? യൂറിൻ റുട്ടീൻ എന്ന് പറഞ്ഞ ടെസ്റ്റും ക്രിയാറ്റിൻ എന്ന് പറഞ്ഞാൽ മാത്രം മതി. ഇതെല്ലാം കൂടെ ഒരു 150 രൂപ ആവത്തുള്ളൂ. വർഷത്തിലൊരിക്കൽ അത് ചെയ്യാൻ പറ്റിയാൽ നല്ലതാണ്. യൂറിൻ റുട്ടീൻ അത് എല്ലാ ലാബിലും ചെയ്യും. ക്രിയാറ്റിനിൻ അത് എല്ലാ ലാബിലും ചെയ്യും.
നമ്മൾ ട്രാൻസ്പ്ലാന്റ് ചെയ്യുന്ന കിഡ്നി ഉണ്ടല്ലോ, അത് സാധാരണ കിഡ്നികൾ കുറച്ചും കൂടി ഔട്ട്സൈഡിലാണ് ഇരിക്കുന്നത്. അപ്പൊ ഒരു ഫിസിക്കൽ ഡാമേജ് പറ്റി അത് ഇതാകാനുള്ള ഒരു
ചാൻസ് ഉണ്ട്. അതുകൊണ്ട് ലിവിങ് ഡോണറിന് ദാറ്റ് ഇസ് ദ ബെസ്റ്റ്. നമ്മൾ പ്ലാൻ ചെയ്തിട്ടൊക്കെ ചെയ്യാം. മറ്റൊരു ആക്സിഡന്റ് സംഭവിച്ച് കഴിയുമ്പോഴത്തേക്ക് തന്നെ കുറച്ച് ഡാമേജ് ഒക്കെ വരും ആ കിഡ്നിക്ക് നല്ല എല്ലാ ഓർഗനും വരാം. സോ അങ്ങനെ ഡാമേജ് ആയ ഓർഗൻ നമ്മൾ എടുക്കത്തില്ല. ഇല്ല അത് ഡാമേജ് ആകത്തില്ല. ഇല്ല.
എന്റെ നൈബർ ഇതുപോലെ പ്ലാന്റേഷൻ സാറിന്റെ ഹോസ്പിറ്റലിൽ ചെയ്തിട്ടുള്ളതാണ്. അപ്പൊ പുള്ളിക്ക് ഇപ്പൊ ഒരു സ്റ്റെപ്പ് കയറാനോ അല്ലെങ്കിൽ കുറച്ചു നേരം നടക്കുമ്പോഴൊക്കെ നല്ല ബുദ്ധിമുട്ട് എനിക്ക് കാണുമ്പോൾ തന്നെ.
അല്ല, അത് ആ കിഡ്നി ചിലപ്പോൾ ഫെയിൽ ചെയ്യുന്നതുകൊണ്ടായിരിക്കും. ആ പൊസിഷൻ കൊണ്ട് പ്രശ്നം വരത്തില്ല. യെസ് ഇറ്റ് ക്യാൻ ഫെയിൽ. യെസ് ഇറ്റ് ക്യാൻ ഫെയിൽ. സെക്കൻഡ് ആൻഡ് തേർഡ് ട്രാൻസ്പ്ലാന്റ് വരെ നടന്നവരുണ്ട്. നമ്മുടെ പഴയ സുപ്രീം കോർട്ട് അഡ്വക്കേറ്റ് രാം ജത്മലാനി അറിയല്ലോ. ഹിസ് ഡോട്ടർ റാണി ജത്മലാനി, ഷി ഹാഡ് 3 ട്രാൻസ്പ്ലാന്റ്സ് ആൻഡ് എ ലിവർ ട്രാൻസ്പ്ലാന്റ്. എല്ലാം സിംഗപ്പൂരിലാണ് പോയി ചെയ്തത്. സോ ദിസ് ഇസ് നോട്ട് 100% സക്സസ്. ദർ ഇസ് നോ ഗ്യാരണ്ടി. ഇപ്പോഴത്തെ മെഡിസിൻസ് വെച്ച് 95% സക്സസ് നമുക്ക് പറയാം. ബട്ട് വെദർ യു ആർ ഇൻ ദാറ്റ് 95, വെദർ യു ആർ ഇൻ ദാറ്റ് 5%, we don't know. 100 വർഷം. Many people are born with one kidney. പലരും ജന്മന ഒരു കിഡ്നിയേ ഉള്ളൂ. സോ മേ ബി ദൈവം കണ്ടിട്ട് നമുക്കൊരു സ്റ്റെപ്നി തന്നതാണോ, വി ഡോണ്ട് നോ.
ട്രാൻസ്പ്ലാന്റേഷൻ സർജറിക്ക് വരുന്ന നമ്മുടെ നാട്ടിൽ പ്രൈവറ്റ് സെക്ടറിൽ വരുന്ന കോസ്റ്റ് എന്താ?
ഡിപ്പെൻഡ്സ് ഓൺ വേർ യു ഡു ആൻഡ് വാട്ട് സോർട്ട് ഓഫ് ഫെസിലിറ്റീസ് യു. ഇപ്പോൾ ലേക്ക് ഷോറിലും ആസ്റ്ററിലും ചാർജ് വേറെ ആയിരിക്കും. ലിസിയിലെ ചാർജ് വേറെയാണ്. ലിസിയിൽ ഞങ്ങളുടെ അവിടെ ഒരു അല്ല, അഗൈൻ ഡിപ്പെൻഡ്സ് ചെയ്യും. നിങ്ങൾ AC റൂം വേണം, അല്ല അങ്ങനത്തെ റൂം വേണം, സ്വീറ്റ് റൂം വേണം, പലർക്കും അത് വേണം. സോ അങ്ങനെ വരുമ്പോഴാണ് ചാർജ് കൂടുന്നത്. പിന്നെ ഈ ഹോസ്പിറ്റലിൻ്റെ ദ ടൈപ്പ് ഓഫ് ഡോണർ, നമ്മുടെ മാച്ചിങ് എക്സലൻറ്റ് മാച്ചിങ് ഉള്ളതാണെങ്കിൽ കോസ്റ്റ് വിൽ കം ഡൗൺ സിഗ്നിഫിക്കൻ്റ്ലി. കാരണം നമ്മൾ അത്ര കുറവ് മരുന്ന് കൊടുത്താൽ മതി. ബ്ലഡിൻ്റെ കിഡ്നിയുടെ ടിഷ്യൂ നമ്മൾ ടിഷ്യൂ ടൈപ്പിംഗ് എന്ന് പറയും. HLA എന്ന് പറഞ്ഞ സാധനം. ഇപ്പം മാച്ചിങ് ഇല്ലാത്തതും ചെയ്യാം. ബട്ട് അത് ഓവർകം ചെയ്യാനായിട്ട് മരുന്നിൻ്റെ അളവ് കൂടും. പിന്നെ ഒരു ചെറിയ റിജക്ഷൻ വന്നു കഴിഞ്ഞാൽ എന്ത് പുറത്തുനിന്ന് വെച്ചാലും നമ്മുടെ ബോഡിയുടെ ടെൻഡൻസി റിജക്ട് ചെയ്യാനാണ്. നമ്മൾ എത്ര സ്ട്രോങ് ആയിട്ടുള്ള മരുന്ന് കൊടുത്താലും ഒരു ടെൻഡൻസി ഉണ്ട്. അങ്ങനെ വന്നാൽ നമ്മൾ പിന്നെയും കോസ്റ്റ് പോകും. സോ ഇറ്റ് ക്യാൻ വേരി ബിറ്റ്വീൻ 5 to 10 to 15 lakhs. Again, now it's just like ഒരു ഹോട്ടലിൽ പോയി താമസിക്കുന്നത്. ലെമെറിഡിന് പോയി താമസിച്ചാലും അപ്പുറത്തെ റെനയിൽ പോയി താമസിച്ചാലും കോസ്റ്റ് വ്യത്യാസമാണ്. രണ്ടും റൂമാണ്, രണ്ടും AC റൂം തന്നെ, ഭക്ഷണവും ഫുഡും ഒക്കെ തന്നെ കിട്ടും. ബട്ട് ദ കോസ്റ്റ് വിൽ ബി ഡിഫറെൻറ്റ്. സോ അങ്ങനത്തെ ഇൻഫ്രാസ്ട്രക്ചറിൻ്റെ വേരിയേഷൻ വരും. ലിസിയിൽ അറൌണ്ട് 5 to 5.5 lakhs ഈ സർജറിക്ക് വരുന്നത്, ഡോണർ ആൻഡ് റെസിപ്പിയൻറ്റ് ടുഗദർ. പിന്നെ പലപ്പോഴും ആൾക്കാർ ചോദിക്കുമ്പം 15 ലക്ഷം 20 ലക്ഷം എന്നൊക്കെ പറയുന്നു. ദേ ഓൾവേസ് ഗിവ് എൻ ഇൻഫ്ലേറ്റഡ് ഫിഗർ. കാരണം എന്നാലേ ഇത്ര എന്തെങ്കിലും കിട്ടുള്ളൂ. ഗവൺമെൻറ്റിൽ നിന്നൊക്കെ ഹെൽപ്പ് കിട്ടണമെങ്കിൽ ഒരു 20 or 30% കിട്ടുള്ളൂ അവർക്ക്. സോ ദേ ഷോ എൻ ഇൻഫ്ലേറ്റഡ് ഫിഗർ. ഇപ്പം 15 ലക്ഷം എന്ന് പറഞ്ഞാൽ 2-3 കിട്ടുള്ളൂ. സോ പീപ്പിൾ ഡു ദാറ്റ് ഓൾസോ.
Thank you so much, sir, for that. I'd like to call Shrikant to come for giving a memento.
Yeah.
Just for a second.
ഞാൻ ചോദിക്കാൻ പോരുത് എവിടെ നിന്ന് എനിക്ക് കിട്ടുന്നത്.
That is kept for you. I saw you reading that actually.
So end of it, I was planning to ask you where can I get a copy of this from.
Video it.
So thank you.
Thank you, sir.
Thank you, sir.